How are you?
Good morning. Are you ready for a report?
I am, yes.
Awesome. All right, so our patient is a 17-year-old female, goes by the name of Kylie Smith. She presented to the ER with her mom, Miss Jenkins, for an attempted suicide. Her mother caught her in the bathroom with a razor blade and surrounded by liquor bottles. She does have a history of substance abuse, self-destructive behavior, and some episodes of blacking out and memory gaps. She has some healed scar tissue on both upper thighs and looks like some fresh ones on both the wrists, which suggests she's a self-mutilator.
Oh, is there any history of mental illness?
Mother denies history of mental illness, but I definitely think there is some abuse going on in the home.
Okay, so we should probably get a psych consult in then today.
Absolutely.
Okay. Well, thank you.
Of course.
Hello. I'm Paige Anderson. I'm going to be your nurse today.
Hey, how are you?
I'm good. So what brings you in today?
Well, my name's Sam. This is my daughter Kylie.
Nice to meet you, Kylie.
I just don't know what to think. I found my daughter on the floor in the bathroom. She had razors beside her. There's alcohol in there, so I immediately called 911 and they came, got her, wrapped her wrist up, and here we are now.
Okay, you did a good thing by bringing her in.
Yeah.
Kylie, do you mind if I ask you a couple of questions about what happened?
Yeah, that's
Okay. Can you tell me where you were? You're at home. Where were you in the home?
I don't know. Before I was just in my room, and then I woke up in the ambulance. Didn't know what was going on.
Okay, you don't remember what happened?
No, I just woke up and they had these bandages on my wrist.
Okay, have you been taking anything?
No, I don't take anything.
Okay, what about alcohol? Any alcohol or anything like that?
No, I don't drink. That's what's weird. I don't understand why my mom's saying that. She found me drinking.
This isn't like her, I've never seen her have any of these kind of behaviors. I don't know if this is just attention seeking or what's going on. I wish she would be able to tell me.
I'm not attention seeking, Mom. I don't know what's going on.
Okay, we're gonna help you. Do you mind if I just take a quick listen to your heart and lungs?
That's fine.
Is anything hurting?
My wrist. I'm fine otherwise.
Lean forward for me. Alrighty. Do you have any bruises or anything?
There's bruises on my arms underneath my wrist, and I have a couple on my legs.
Okay, I see. Alright. Mom, can I take you outside for a second?
Sure.
Talk to you privately.
All right, honey. I'll be back, okay?
I'll be back in just a second. There's a place up here we can sit and talk for a second. So based off of what you were saying and what she was saying and off my assessment, I think it would be in her best interest to get a psych consult down here. And with her being under 18,
but my daughter is not crazy.
we just think that it would be better to just cover all bases and know where we're coming from with the inconsistencies that she had in her story and with what you had to say. It wasn't matching.
You're not gonna lock her up or anything like that, are you?
No, it's just a consult. We're just gonna have the doctor come down and talk to her. I'm gonna review this information with him, and we will be with you shortly, okay?
Okay. I take good care of my daughter, you know that, right?
Yes, ma'am, I understand that.
Okay. Well, I will allow it.
Good morning, Nurse Paige. I'm Caitlin. I'm Dr. Green. I'm the psychiatrist on the unit. What's going on today?
Oh yes, thank you for coming. So I have a 17-year-old female who came in from the emergency department this morning. She came in because she has a history of substance abuse and attempted suicide. So when I went in and did my assessment, the stories weren't adding up.
Okay.
They were inconsistent. Her mom was saying one thing and the patient was saying another thing.
Okay.
Vitals are for the most part normal. Blood pressure is elevated, and so is heart rate. So I just thought that it would be best to get you to come in and talk to her and what you think, and see what you think.
All right, well, I'll go ahead and head in there and I'll come back and let you know when I find out about that.
Thank you.
Good afternoon.
Hi.
Hi, I'm Dr. Green. Nice to meet you.
Hey, I'm Sam Jenkins.
Sam, nice to meet you. I'm Dr. Green. I'm the psychiatrist on the unit, so I'm here to do Kylie's assessment today.
Okay.
Nothing to be scared of. We're just going to chat a bit. Mom, do you mind stepping out for a bit while I ask Kylie some questions?
Are you okay if I leave you?
Yeah, that's fine.
You sure? Yeah. Okay. Well, if you need me, I'll be right out here. You let me know, okay? All right.
I see you've got some bandages on your wrist. Do you want to tell me how that happened?
I don't remember.
You don't
I
remember.
just woke up and they were on my wrist and my wrist hurt, but I don't know.
Okay. Have you ever had this before where you just don't remember?
Yeah, sometimes people will tell me like I did something or said something that I didn't do or say, and I just thought that they were not my friends lying,
Yeah. Okay. What about your alcohol consumption? What can you tell me about that?
I don't drink at all, but like some days I wake up and I have like this pounding headache, like I have drank or something, but I don't.
Okay. Do people ever tell you that you've said or done things that you can't remember?
Yeah, sometimes, and it freaks me out because I'm like, I would remember doing something that you're saying I'm doing, but I don't. So it's like, what the heck?
Okay. So about this incident, what is the last thing that you remember?
Oh my goodness. Honey, is that you?
Yeah, it's me.
What is wrong?
I got laid off because of you.
What did I do?
Not waking me up in the morning, no food when I get home, no breakfast made in the morning.
Sounds like you got a problem.
This ain't even the kind of beer I like, woman. You know I only drink Michelob Ultras.
Too bad.
What is wrong with you?
What is going on
You have
out
a fire in
here?
this
What's
house?
going on in here?
Get out of here!
Brad!
Get away from my daughter! Honey!
Through this.
You know, get out of my house.
I'm gone.
Move it! Asshole. Where's my daughter at? Open this door! I said open this door! What is wrong? Come on! Sit up, Kylie! What is this? What the hell? Are you okay? Alright, call 911!
You know, the last thing I remember was Brad and my mom getting in an argument. It was getting really heated, and then I went in to intervene, and Brad slapped me. And I just saw red, and I did what I needed to do. Grabbed a bottle of liquor, grabbed a knife, and tucked away in the bathroom. You know what I mean? I had to get away.
All right, Kylie, thank you for sharing that with me. I know that was really difficult for you.
Yeah, Doc, my name's not Kylie.
Your name's not Kylie?
No.
Where did Kylie go?
Kylie, she's safe. I take care of things for us, don't worry.
Okay. What do you like to go by?
My name's Taylor.
Taylor.
Yeah.
All right, Taylor, let me just clarify and ask you this. Do you have any thoughts of harming yourself or others?
I mean, I wouldn't put it like that, but I do what I need to do. I take care of what's necessary. And if that includes hurting me or someone else, then yeah, I'll end it all for it.
Okay, so Taylor, you would harm yourself or others?
Yes, Doc. I would do what needs to do, take care of what's necessary to keep us safe, you know?
Okay.
Point big period.
All right, Taylor, well, thank you for talking with me. I'm going to go talk with the nurse and then chat with your mom, okay?
Whatever.
Hey.
How you doing?
All right, so after talking with Kylie, I've decided to place her on an involuntary Baker Act. It is a 72-hour hold, and that is because of her lacerations on her arms and the fact that she did admit to me that she would harm herself or others. So upon her Baker Act, we're also going to get her into some inpatient therapy. And upon my consult, I do believe that she's showing signs of dissociative identity disorder.
What's that?
So dissociative identity disorder is when two or more distinct personalities, usually a reaction to trauma, as a way to help a person avoid bad memories. So actually in talking with her, I got to meet one of those personalities, and she goes by Taylor.
Wow. I've never heard that name before.
I have a pamphlet here for more information on dissociative disorder if you wanted to take
Okay.
a look at it. If you have any more questions, you can always contact me or the doctor. And there's
As long as you take care of my daughter, that's what's most important.
Yeah, and she'll be safe with us. And then within the therapy that we're gonna do, we're gonna work with her to help manage this disorder as much as she can. We'll probably prescribe her some antidepressants or some anti-anxiety medication, and then try out some different therapies, talk therapy, cognitive behavioral therapy, see if she could do EMDR, basically just to get down to her trauma and figure out her triggers and just try to help her live a normal life.
So the treatment for it is not just medication.
No, it's not just
therapy.
medication. Yes. The medication's basically just going to help with the anxiety and depression aspect of it, and then the therapy will actually dig down deep so we can discover those traumas and help to heal and have her live a normal life.
Well, if I'm being honest, I just wonder when I think back at all the years, I've raised her on my own, but I've had, different men in my life, and it's been an unstable home with a lot of arguing, and she's been a witness to all of that. So do you think that could stem from?
That could be a possibility, but like I said, once we get her in the inpatient program and we do some therapy, we'll really be able to figure out the cause.
Okay. All right. Well, thank you guys.
Thank
Please
you.
tell her I said hello and give her a kiss for me, okay?
We will. Thank you.
All right. Thank you.
3 days later.
After Kylie's Baker Act, she was admitted for inpatient therapy. Throughout her admission, she underwent different types of therapy. This therapy included group therapy and EMDR, otherwise known as eye movement desensitization and reprocessing. It is a form of psychotherapy designed to alleviate the distress associated with traumatic memories such as post-traumatic stress disorder, which is a cause of DID.
Action.
All right, Taylor, I'm just going to ask you a couple questions.
Taylor?
Right?
Oh, shit. What's your name?
It's safe, don't worry.
Okay.
Where did she go?
What did you
No, cut it.
Have you ever noticed that things are... I'm sorry.
Damn it! What is your problem?
My name's not Kylie.
You're just not...
Shaylee!
Well, oh my god, I'm sorry.
Wait, don't. Therapeutic.
I am tired of hearing you complaining.
You know what? I'm tired of you talking.
I'm
gonna do something about that. For sharing your story.
Your story?
Guys,
Did you not film the whole thing? What are you doing?